Okay, يا شباب. Today we are going to revise all the physiology of the visual system. We are going to highlight only the most important. We are not going to discuss. Just as true and false, and give you the true information. Okay? فأي كلمة هنقولها, this is the true. Otherwise, it's false. Okay? Right. In general, كده, the retina is the inner layer inside the globe. We have two important compartments of the globe. First, the optical system, including the avascular structures, avascular cornea and lens, and fluids like aqueous humor and vitreous body. All these are transparent and making as an ocular system, optical system. The most powerful part of this optical system is the cornea. The cornea contributes 2/3 of the power of the optical system. 2/3 of the power of the optical system. Because of its curvature and because of its interface with air, and the refractive index of the air is much more away from the refractive index of the cornea. The other media, cornea, aqueous humor, lens, vitreous humor, are close to each other in its refractive index. The refractive index of air is 1, the refractive index of the cornea is 1.38. Okay? Right. The blood supply of the inner surface of the retina is compromised because it is a small central retinal artery, and this central retinal artery supplies the inner surface of the cornea. The outer surface supplied by choroid plexus. Detachment of the retina lead to this separation of the outer layers of the cornea from the choroid plexus lead to disc of receptors. Disc of receptors, because the receptors are very close to this layer, choroid plexus. The layers this is the optical system, and this is the retina. The layers arranged The optic disc is very important. It is a mirror that reflecting the change inside the brain, because there is durameter, arachnoid, and biometer. These are the sheaths that cover the brain and reflected on the optical nerve. Any increase of the pressure in the brain by tumor, hematoma, or blocking of CSF will lead to papilledema, bulging of the optic disc, haziness of the optic disc, papilledema. Okay? Fine. Regarding the refractive media, we mentioned that the cornea is the maximum refractive power, causing maximum refractive power, and it is transparent because of avascular and lamination arrangement of the epithelial cell in regular laminae. Okay, avascular type, and the power it contributes about 80% or 2/3 of the refractive power of the total refractive power of the optical system is about 60 diopters of 58. 48 of the 58s done by the cornea. But the problem in the cornea is that it is fixed in its refractive index. Fixed, so we cannot change the power of the cornea. There is protection of the cornea by the eyelids, by reflexes, and by the tears. Eyelids, cornea reflex, and the tear. It is supplied by bare nerve endings. Bare nerve endings. So it is very sensitive organ. Sensitive to change to pain. Okay? Aqueous humor, we mentioned there is another topic related to aqueous humor, we'll discuss it. So we will skip this aqueous humor now and go to the lens. The lens contribute by 1/3 of the adaptive power of the lens, of the optical system of the eye, but it is changeable. So we can increase the power of the lens by contraction of ciliary muscle, relaxation of suspensory ligament, and increase the curvature of the lens. The anterior surface of the lens is becoming more curved. So the change in the lens mainly in the anterior surface, not in the posterior surface. Why? Because it's posterior surface facing the vitreous body, and this vitreous body is semi-solid. But anterior surface facing the aqueous humor, so it can push the aqueous humor. So the curvature of the anterior surface of the lens is more important than the curvature. The most important point here, contraction of ciliary muscle lead to relaxation of suspensory ligament, lead to making the lens more globular, increase the power of the lens. Okay. The composition of the lens, there is ascorbic acid and glutathione, high concentration of ascorbic acid and glutathione. The value of presence of high ascorbic acid and glutathione is to limit the aerobic glycolysis. It will limit the aerobic glycolysis to the outer layers of the lens. So the center of the lens is in a reduced media. There is no aerobic glycolysis in the center of the lens, only in the outer surface. So the glutathione inside the lens will prevent the oxidative, the aerobic glycolysis to be in the center of the lens, limited to the surface. So it is ascorbic acid and glutathione antioxidants, and has a role for limitation of aerobic glycolysis. We mentioned in the metabolism of lens, it is mainly anaerobic glycolysis. So metabolism of the lens is anaerobic glycolysis. Only the outer layers can contribute by 20% of glycolysis aerobically. If there is aerobic glycolysis inside the center of the lens, there will be release of free radicals, and these free radicals can damage the lens, make opacification. So the metabolism mainly anaerobic glycolysis, glutathione and ascorbic acid, antioxidants, removal of free radicals, limit the aerobic glycolysis to outer surface of the lens. Okay, as we mentioned, in diabetes there is accumulation of sorbitol in diabetes metabolism. There is accumulation of sorbitol, and this leads to opacification of the lens. Right? This is the mechanism of glutathione and ascorbic acid in lens metabolism. You can read it. There is no problem in reading it. Okay, and this is the role of glutathione in, it's not mentioned in the lectures. This is for your knowledge. بس اللي لازم تعرفه ان الجلوتاثيون والاسكوربيك اسيد دول antioxidants protections the center of the lens from aerobic glycolysis and limit the aerobic glycolysis to the surface of the lens. Okay? Transparency of the lens, of course, it is transparent because it is avascular organ. Avascular organ, and takes the nutrition from the surrounding aqueous humor. Okay? Vitreous humor, transparent, but it is semi-solid. Semi-solid. It is not a fluid in nature, it is semi-solids, and the function of this vitreous humor, two important functions. Making the shape of the globe, protection, prevent detachment of the retina, and of course, nutrition and removal of waste product. Making the shape of the globe, protects the retina from detachment, and of course, exchange of metabolites nutrition. Okay. These are important slides for refractive indexes of the optical system. The interface, we have 4 interfaces between air and cornea, between cornea and aqueous, between aqueous and lens, and between lens and vitreous. These are 4 interfaces. The 3, cornea, aqueous, lens, and vitreous, the refractive index is almost nearby, so there is minimal refraction. The refraction, we consider the refraction between the air and the cornea is the refraction of the optical system. Because there is big difference between refractive index of air and refractive index of the cornea. Okay? We have what's called reduced R. Reduced R is the sum of the refractive media together making one refractive optical system. Reduced R, the summation of all the refractive media of the eye. Reduced R. And this reduced eye has what's called nodal point. Nodal point is the center of this reduced lens. يعني نجمع كل الاوبتيكال سيستم as one lens. النودال بوينت بتاعتها اللي هي السنتر of this lens is 17 ملم in front of retina. ماشي؟ يعني بقول بوينتس خلي بالك. يعني دي بوينتس يعني I have to ask this. يعني أي كلمة بقولها يبقى ممكن نسأل فيها. طيب. Okay. Visual axis passing through the nodal point and go to the fovea. And we are going to move to the fovea and we said what's this? Aqueous humor. خلاص. طيب نكمل aqueous humor. Aqueous humor طبعا هو produced from the ciliary body, goes around the lens in the posterior chamber, then enter the anterior chamber, and drained by canal of Schell. Okay? Right. The function of aqueous humor, maintain intraocular pressure. The normal ocular pressure is less than 21 millimeter mercury. يعني from 10 to 20 millimeter mercury. This is the normal intraocular pressure. Right. Increase intraocular pressure either by increased production or decreased drainage. ماشي؟ Aqueous humor formation is an active process for selective production or secretion of certain substance in the aqueous humor. course, there is much more less amount of protein when compared with plasma. Much more less amount of protein in the aqueous humor when compared with the plasma. There is a barrier between the plasma and our blood and aqueous humor, and this barrier formed of two cell layer, pigmented epithelium and non-pigmented epithelium, and it is an active process. Active process. طبعا active process like CSF need two important enzymes. Carbonic anhydrase and ATPase. Carbonic anhydrase and ATPase. And you can manipulate the aqueous humor production by using antagonists. Carbonic anhydrase inhibitor and ATPase blocker. Okay, خدت ATPase blocker اللي هو ايه digitalis cardiac glycosides inhibit the ATPase وكربونيك anhydrase inhibitor. اوكي طيب adrenergic receptors. Alpha adrenergic receptor stimulation decrease the aqueous humor. Beta receptors increase aqueous humor formation. يبقى beta receptors increase production of aqueous humor. Alpha receptor stimulation decrease production of aqueous. طيب drainage. cholinergic innervation and open the canal of Schimp, increase removal of aqueous humor. يعني cholinergic أو parasympathomimetics drugs increase drainage of aqueous humor. Anticholinergic drugs will decrease drainage of aqueous humor. Atropine will increase the intraocular pressure because it will decrease the drainage of aqueous humor from the canal of Schimp. خلاص؟ Okay. عندنا في direct drainage وفي indirect drainage. ده يعتبر as a protective. If there is occlusion of canal of Schimp, trabecular occlusion, there will be another indirect way that uveus scleral outflow. So عندنا trabecular outflow and uveus scleral outflow. Okay? الuveus scleral ده indirect way. والtrabecular outflow ده common way for drainage. Of course, there are many factors that affect aqueous humor, variability between sex, between races, between ages, between activities, sleep, and so on. So you know what increase the aqueous humor, what decrease the intraocular pressure, what increase or what decrease. Okay. Spectrum of vision, we have scotopic vision and photopic vision. Scotopic vision for dim light and photopic vision for light, sunlight. There is overlap. Of course, the cones will respond to photopic vision. It is concentrated, highly concentrated in the fovea. So we have macula, and inside the macula there is fovea, and inside the fovea there is fovea. So in the fovea there is only cones. Even there is no other cells, bipolar or ganglionic. The bipolar and ganglionic shifted laterally from the fovea. This is the central vision. There is only cones in this area, and there is high acuity in the area of fovea. And this is a distribution of Only in the fovea there is only cones. And gradually increase when we go to the periphery, and the rods in the opposite side. There is no rods in the fovea, no rods in the fovea, and gradually increase when we go periphery. Okay? The optic disc is in the nasal part to the fovea. Optic disc nasally to the fovea. يعني النوز هنا يبقى بعدين الاوبتيك ديسك وبعدين الفوفيا lateral. اوكي؟ طيب الفرق بين dim light vision والbright light vision ان في الريسبتورز الرودز threshold of stimulation for rods is very low. Threshold of stimulation of rods is low when compared with cones. الكونز محتاجة brightness، محتاجة high threshold for stimulation. لكن الrods low threshold, so it can be stimulated in the very low illuminated medium, in the dim vision. Okay, we have 3 pigments in the cones and 1 pigment in the rods. The sensitivity of the rods is very high when compared with sensitivity of the cones. And threshold of stimulation is very low for the rods when compared with the cones. Okay, almost for all the rods will develop conversion. And the function of conversion is to intensify the weak stimuli. Conversion increase the response. Okay? But for the cones, for high acuity, there is minimal conversion, 1 to 1. 1 receptor, 1 bipolar, 1 ganglionic cells for increased acuity. Okay? We have here that the receptor layer is in the outer part of the retina. And this is the inner part. So the outer part of the retina, there is receptor. Outer part of the retina is receptors. And it is very close to pigmented cell layer. And the function of pigmented cell layer is to absorb the light after stimulation of the receptors. تاني حاجة removal of the old discs from the A receptors. Removal of old discs. يعني عارفين إن في renewal of discs. Renewal of disc يعني disc بتتكون in the near the inner segment and then go to the outer segment. Pigmented cell layer absorb the light after stimulation of the receptors and removal of all discs from the rods. Okay? Mechanism of stimulation of the receptor, and in the darkness there is continuous opening of the sodium channels, continuous opening of sodium channel in the outer segment, and continuous pumping of sodium on the inner segment. Presence of cyclic GMP keeps the sodium channel open in the dark. Light will convert 11 cis to all trans. And this conversion this is conformational change, not a reaction, not a chemical reaction, not oxidation, not reduction, not breaking of bond. It is just conformational change. Light make only conformational change from 11 cis to all trans. And this will decrease the cyclic GMP, closure of sodium channel, lead to accumulation of sodium outside, state of hyperpolarization, decreased release of inhibitory neurotransmitter glutamate. Decreased inhibitory release of inhibitory neurotransmitter. So the neurotransmitter here in the receptor cell is glutamate, and glutamate here is an inhibitory neurotransmitter released in a state of depolarization in the dark. So in the dark there is spontaneous release of glutamate that suppress other cells, bipolar cells. Okay? Light lead to a hyperpolarization, decreased release of inhibitory neurotransmitter, lead to activation of the other cell, bipolar cell. Have the light increase, develop hyperpolarization, light will decrease cyclic GMP, close sodium channels in the upper segment, still there is bumping of the sodium outside in the inner segment, active transport, so there will be accumulation of sodium outside, state of hyperpolarization, decreased release of the inhibitory neurotransmitter. Sequence. So its response is by hyperpolarization. The difference between the cells in the retina, all the cells except ganglionic cells respond by graded potential. Receptor cell, bipolar cell, amacrine cell, horizontal cell respond by graded potential. That's to say, increase intensity of the stimulus, increase the grade of receptor potential. كل ما يزيد الانتنسيتي يزيد الجريد of receptor potential, graded potential. Only the ganglionic cells respond by action potential. And the relation between action potential and intensity of the stimulus, increase intensity of the stimulus, increase the frequency of action potential on by ganglionic cells. Right. In differences between retinal receptors, retinal cells, we have three images developed in the retina at the level of receptor. First image at the level of bipolar cell, second image, and at the level of the ganglionic cell is the third image. The receptor responds by hyperpolarization. Bipolar cell responds by depolarization or hyperpolarization. And this response leads to increase the range of sensitivity and for fine discrimination of contrast. Fine discrimination of contrast. You have discrimination of contrast by bipolar cell, fine contrast, and increase the range of sensitivity to illumination. Horizontal cells respond by hyperpolarization causing lateral inhibition, and the function of lateral inhibition is sharpening of the stimulus, sharpening the image, see the details. Right. Amacrine cells respond by depolarization, and for lateral inhibition, function for lateral inhibition, and detect the movement of the object in with fixed background. The detection of the object will be stimulated if the object moves with a fixed background. So there is, here we can discriminate some sort of movement of the object, visible object. Ganglionic cells and the basal activity to speed up conduction. Only cells that develop action potential. وفي عندنا on center ganglionic cells و off center ganglionic cells. عندنا magnocellular ganglionic cells for movement and distance, and parvocellular ganglionic cells for color and shape. Magnocellular cell and parvocellular cell. وبعدين عندنا cells on off center وفي opponent response to different colors. Red on, central red, peripheral green. The opponent colors antagonize each other. Dark adaptation, the cones are rapidly adapted to darkness, but weak, not sustained for a long duration. And the rods can maintain or increase its sensitivity